Hi, everyone. We're 10 Point Advantage, Team 10 Point Advantage, and we chose to do our project on a home health agency in Dallas, Texas. So, my name is Doug Wheeler, and our group members Lauren Wells, Caitlin Woods, Cody Wright, Regina Williams, Nala Young, Jacelyn Willis, and Justin Yusefzadeh. So, our organization, as I said, is Acceptance Home Health. It was started in 2019 by a physical therapy assistant. His name is David Shannon. And so we compete, this organization competes with other larger home health agencies in the Dallas, Texas area, some of them including Encompass, Amedisys, and Accent Care, as well as multiple locally owned home health agencies. So our organization that we chose, it focuses on patient care, uh, through nursing, skilled physical therapy, occupational therapy, and speech therapy. As I said, it was founded in 2019. Everything the organization does is patient centered and improving patient outcomes. So, how that works, the organization receives a referral from a physician. The back office takes that referral, looks at what is needed for that patient, and then assigns a team of clinicians to then contact that patient, schedule visits, and go from there. Each visit is documented at the point of service. That documentation takes place in Access, a electronic medical record system, and so that system is our focal IS for the project. The documentation is then used to generate claims, which are then submitted to various insurance payers, and then those payments are received and distributed among clinicians and the back office. So that's kind of the basics, and then we'll dive in from there, and I'll turn things over to Lauren.
Thank you, Doug. So, why does this process matter? Well, it directly impacts patient safety, compliance, and revenue. Accurate care planning and documentation ensures patients receive safe, appropriate services. At the same time, strict regulatory requirements mean every service must be fully supported in the record. Errors can lead to denied claims, audits, and financial loss. Since reimbursement depends entirely on clean documentation and correct billing, efficiency in this cycle speeds up payment and improves overall outcomes. In short, strong process management protects both patients and the organization. On the next slide, we will go over the process flow overview. So first, a referral is received, and then eligibility and authorization are verified. Next, a plan of care is developed, and then clinicians are scheduled and dispatched to complete visits. Then visits are documented, claims are generated and submitted, payments are then posted, and any denials are managed. Throughout care, patient outcomes are monitored, and discharge is planned when goals are met. This structured flow keeps patient care, compliance, and reimbursement aligned from start to finish. Now I'll turn it over to Regina.
So the primary supporting information system used by Acceptance Home Health is Access EMR. It's a cloud-based electronic medical record system, and it integrates clinical documentation, scheduling, billing, and compliance into a single platform. Because care is delivered at patients' homes, remote access is essential. Clinicians use the mobile application, which includes GPS tracking, timestamps, and electronic signature. These features are particularly important for Medicare and Medicaid since they require verification that services were delivered at the patient's home. From an information systems perspective, Access functions primarily as a transaction processing system. It captures high-volume clinical and billing transactions, and it also provides reporting tools that support managerial oversight. Most importantly, the system directly supports the organization's core business process of patient care delivery and reimbursement. This slide illustrates how Access supports the entire patient care and reimbursement cycle. At the referral stage, the system enables electronic intake and eligibility verification, which reduces administrative delays. During care planning, physician orders and digital care plans are centralized within the platform. And when clinicians conduct visits, they document care through mobile application, GPS verification, and timestamps, strengthen the internal controls, and support regulatory compliance. Once documentation is completed, the system generates claims automatically, reducing errors and improving reimbursement speed. In addition, compliance dashboards allow management to monitor documentation accuracy and audit performance. Overall, the system integrates each stage of the workflow, improving both operational efficiency and financial sustainability. There are 5 critical success factors that determine whether this process performs effectively. Accurate and timely documentation ensures both high-quality patient care and reimbursement accuracy. Efficient claim submission protects cash flow in a reimbursement-driven environment. Patient satisfaction supports referral relationships and long-term organizational growth. Scheduling efficiency ensures services are delivered as ordered, and regulatory compliance remains essential in a highly regulated healthcare industry. Together, these factors align with the organization's strategy of delivering quality care while maintaining financial and regulatory stability. The organization evaluates performance through system-generated metrics. Documentation audits assess record accuracy and completeness. Claim acceptance and denial rates measure billing effectiveness. Days in accounts receivable indicate how quickly services are converted into cash. Visit completion rates reflect scheduling reliability, and compliance audit results ensure adherence to CMS standards. By monitoring these metrics in real time, management can identify performance gaps and implement improvements. This demonstrates the information system not only supports operational execution, but also enables data-driven strategic decision-making. And then I'll hand it over to Caitlin.
So now we can discuss the infrastructure and architecture of the system. It is a cloud-based system. That way you can access it through different forms of electronics such as laptops, tablets, and smartphones. It is a vendor-hosted server, and it does have encrypted internet connections to help protect all of the client's information and things like that. The cloud model does increase accessibility and reduces internal IT burden, but it also does create reliance on the vendor and stable internet connectivity. So you can go ahead to the next slide. So some of the information management challenges, like I kind of stated before, was vendor dependency, low internet connectivity risk, staff training, adaptation challenges, and downtime procedures required. So while the cloud systems do provide a higher accessibility rate, it does introduce different operational risks that may be actively managed. So the home health supply chain, so with upstream, it's payers, clinicians, equipment, and technology vendors. Then it'll move to internal intake, scheduling, care, coordination, and then downstream patients, hospitals, physician, payers. So home health relies on coordination across multiple stakeholders, and information flow is critical at every stage. Porter's 5 forces summary. The threats of new entrants is kind of moderate. The threat of substitutes is also moderate. Supplier power is moderate to high. Buyer power is high. Competitive rivalry is high. The home health industry is highly competitive with strong buyer power and intense rivalry, making differentiation and operational excellence essential.
And now we'll hand it over to Cody.
Acceptance Home Health follows a differentiation strategy. Rather than competing on price, the organization differentiates itself through quality outcomes and patient-centered care. Compliance reliability is a key part of the differentiation, especially in a highly regulated industry where documentation accuracy and regulatory adherence directly impacts reimbursement and reputation. Workforce stability also supports this strategy. Consistent staffing improves care continuity, strengthens referral relationships, and enhances patient satisfaction. Together, these elements create a competitive position focused on quality, trust, and operational reliability rather than scale. This slide highlights how Acceptance Home Health creates value across its primary activities. Inbound logistics include referral intake and eligibility verification, which determine whether care can begin. Operations represent the core service activity, which is in-home care delivery supported by clinical documentation and scheduling. Outbound logistics involve billing, reporting, and communication with payers and physicians. Marketing focus primarily focuses on referral relationships rather than traditional advertising. Service includes follow-up, care coordination, and patient education to ensure continuity of care. Because this is a service-based organization, value is created through information flow, coordination, and clinical performance rather than physician or physical production.
We will pause for an inside look from Doug.
So I'll talk a little bit here about what Access is. So this is the login screen, and then here is a test patient chart. You can see there's several different visits plotted for the patient, different assessments and therapy visits. They're all plotted to me. So let's go ahead and take a look. This is what a basic evaluation looks like, kind of the first page. You can put your time in and time out. You can also discuss any patient comments, subjective. So this pretend evaluation for this patient, just talking about he made up a scenario here, but had a fall, hit his head, developed a brain bleed, and then I can then enter different things like how the patient does with bed mobility, how they get around their house, things like that. And then here's what the phone app looks like to collect the patient's signature at the time of service, and that verifies that we were actually there in the home. That is a Medicare CMS requirement. And then once that's done, it generates a billable note document that can then be sent for billing and also to the physician.
And now back to Cody.
On this slide, it illustrates how Access EMR strengthens the organizational support activities within Porter's value chain framework. Under firm infrastructure, EMR data supports leadership decision-making, financial oversight, billing integration, and compliance reporting. Management uses real-time system data to guide strategic planning, monitor performance, and ensure regulatory adherence. Under human resource management, Access supports recruitment, onboarding, training, and performance monitoring. System metrics provide visibility into clinician productivity, documentation accuracy, and scheduling efficiency. Improved workflow tools contribute to workforce stability in a labor-constrained industry. In technology development, the platform continuously evolves through vendor-managed updates in the cloud, mobile app enhancements, and security improvements. The mobile application supports field technicians with visit verification, document capture, and patient signature collection. Ongoing HIPAA compliance and data security updates protect sensitive patient information and maintain regulatory compliance. Under procurement, the system supports EMR licensing, hardware coordination, and vendor relationship management. It also helps document and track medical equipment and medical supply coordination. Collectively, these activities demonstrate that Access does not simply care, it enables coordination, compliance, operational control, and strategic visibility across the organization. And a service-based healthcare environment, sustainable competitive advantage is created through information management and Access functions as the central infrastructure supporting that value.
Finally, we hand it over to Justin.
Through this project, one of the biggest lessons we've learned is that technology itself doesn't create value, alignment does. Access EMR is a powerful system, but its effectiveness depends entirely on how well it supports the underlying business processes. If documentation workflows are inefficient or staff aren't properly trained, even the best software can create bottlenecks instead of efficiencies. Next slide, please. Based on our analysis, we identified several recommendations for Access Home Healthcare for the going forward. First, we recommend expanding predictive analytic capabilities so that they could better forecast staffing needs and reduce scheduling bottlenecks. Second, we also recommend referral integration with hospitals and physicians to create a more seamless information exchange. Third, continuous staff training is critical. As technology continuously evolves, compliance standards change, and new features are added regularly. Fourth, the organization could benefit from exploring a broader ERP integration beyond just the EMR system. By integrating HR, finance, supply chain into a unified platform, it would enhance enterprise-wide visibility. Next slide. So why does this all matter? It matters because in healthcare, process efficiency directly affects patient outcomes. Better technology leads to better documentation. Better documentation leads to faster and more accurate reimbursement. Faster reimbursement improves financial stability, and financial stability allows the organization to invest in quality care. For a smaller, locally owned organization like Acceptance Home Health, leveraging technology effectively is what allows it to compete with billion-dollar national providers. Next slide, please. As a team, several things stood out to us during this project. We were surprised by how complex the reimbursement cycle really is, and many of us didn't realize how documentation accuracy determines whether revenue is received, if at all. We also gained a deeper understanding of how compliance shapes nearly every operational decision in healthcare. It's not just about efficiency, it's about meeting strict regulatory standards at every stage. Overall, this project reinforced how interconnected business processes, information systems, and strategy truly are, especially in highly regulated industries like healthcare. Thank you.